Welcome to this explainer on head and neck surgery recovery. Look, if you're watching this right after your procedure, I want you to just take a nice, deep breath. It's completely normal to feel a bit of anxiety or, uncertainty right now. Your body has just been through something significant, and honestly, looking at those bandages or just feeling those post-operative sensations, it can absolutely be overwhelming. But you're in exactly the right place. We're going to walk through everything you need to know, step by step. You have a very clear, very manageable path ahead of you, and we're going to make sure you feel totally confident and secure in your recovery process. So let's dive right in.
To make this process as simple as possible, we've broken your recovery down into 5 distinct phases. 1. Immediate post-op and bleeding. 2. Daily wound care. 3. Activity restrictions. 4. Pain medications. And 5. Warning signs.
Starting right off with Phase 1, immediate post-op and bleeding.
During those first critical 24 to 48 hours right after you get home, it's incredibly common to feel a little nervous. But I want to assure you, the most common sources of panic are actually completely normal. Things like bleeding, swelling, and even saturated bandages are totally expected. Your bandage might get completely soaked in blood, and it might even leak a bit. I want to strongly reassure you right now, this is not a cause for panic. Furthermore, it's really common to see bruising and swelling that actually travels downward, toward your forehead or your eyes. In some cases, your eyes might even swell shut. I know it looks intense, but it's just a standard part of the healing process, and it'll slowly dissipate over the next week or two.
Now, if your bandage does become completely saturated and it's just no longer absorbing blood, here is exactly what you need to do. First, remove that saturated bandage so you can get directly to the source. Second, grab some fresh gauze, a clean paper towel, or a washcloth and apply it. And third, and this is absolutely crucial, you must press firmly and directly on the surgical site for 30 full minutes. And I mean without peeking. I know the temptation to lift up and check if the bleeding is stopped after 10 minutes is huge, but checking releases that pressure and breaks the exact clot your body is trying to form. So set a timer, sit back, and hold that firm pressure for an uninterrupted 30 minutes.
Let's talk about the bandages themselves, because there are actually 2 layers here. Please remember, these bandages aren't medically necessary for your healing. They're really just there to contain bleeding and keep your clothes clean. The outer layer is that big, bulky white bandage made of gauze and tape. You'll leave this one on for 24 hours or up to 48 hours if you had significant bleeding. Once that time's up, you can take it off and go ahead and safely shower. Underneath that, you'll find a clear, waterproof bandage with a white pad. Don't be surprised to see blood trapped under there. That's completely normal. This clear bandage usually just falls off on its own in a day or two, but if it's still hanging on by day 6, go ahead and gently remove it yourself. Also, for the first 48 hours, keep your head raised. Don't sleep on the side of your incision. Use a couple extra pillows or just sleep in a recliner, because that's really going to help minimize that swelling we talked about earlier.
Moving on to Phase 2, daily wound care. Once those initial bandages are off, your daily wound care routine is empowering, it's super simple, and it puts you right in the driver's seat of your healing process. You only need to follow 4 simple steps every day. Step 1 is definitely the most vital. Always wash your hands thoroughly first to protect that healing skin from infection. Step 2, gently clean the incision daily with mild soap and water. Step 3, apply a generous, thick layer of Vaseline right over the incision. And Step 4, just cover it with a clean bandage. Any basic bandage you have at home works perfectly fine. You're going to do this every single day until your stitches have completely dissolved or been removed.
Now, there is a critical rule here for your long-term cosmetic result. From day 1 all the way to day 30, so 1 full month, your absolute only topical treatment is applying Vaseline daily. You must keep the wound moist with Vaseline for that entire first month. You cannot use anything else. Only after you've hit that 1-month mark, day 30 and beyond, are you allowed to start applying sunscreen, makeup, or scar reduction products like Silogen to the area. Protecting that incision with Vaseline exclusively for 1 full month is paramount for optimal healing.
Let's transition over to Phase 3, activity restrictions.
Healing isn't just about what you put on the wound. It's also about how you move your body over the coming weeks to protect that repair. For at least the first 2 weeks, you'll need to make some deliberate lifestyle adjustments. You really must strictly avoid heavy lifting, heavy cardio, bending over, and any strenuous activity in general. The goal here is simple. We want to avoid anything that spikes your blood pressure, stretches the fragile new tissue of the repair, makes you sweat a lot, or puts direct tension on the wound. Keeping things calm and steady gives your body the physical peace it needs to knit those tissues back together nicely.
But hey, don't worry, you don't have to just sit completely still. Light walking is perfectly fine, and honestly, it's great for your overall circulation and well-being. However, I do want to draw your attention to a longer-term restriction when it comes to heavy lifting. While the general restrictions only last 2 weeks, Heavy lifting really should be approached with caution for the first 3 months. Why? Because lifting heavy objects puts intense strain on the skin, and that can actually cause your scar to stretch and widen, even weeks down the line. So, to keep that scar as thin and minimal as possible, let someone else carry the heavy groceries for a little while.
All right, phase 4, pain medications. Making sure you're comfortable internally is just as important as caring for the wound on the outside. First off, you may immediately resume all of your usual over-the-counter and prescription medications. If you paused anything prior to surgery, it's safe to start taking it again now. Now, for managing post-operative pain specifically, we have a highly effective over-the-counter plan that works beautifully for most patients. You can take 2 extra-strength Tylenol, which is acetaminophen, right along with 1 to 2 ibuprofen like Advil or Motrin. You can take these together every 6 hours, just making sure you strictly follow the directions on the bottles, assuming you don't have a specific medical condition that prevents you from taking them. This combination is fantastic at keeping inflammation down and keeping you comfortably resting.
Additionally, if your medical team discussed an antibiotic with you and sent a prescription over to your pharmacy, please pick it up and take it exactly as directed. It's generally highly recommended to take your antibiotics with some food just to prevent any stomach upset. And it goes without saying, but if you happen to experience any side effects or signs of an allergic reaction to the antibiotic, stop taking it immediately and call the office for further instructions.
Which brings us to our final phase, phase 5, warning signs.
Establishing a secure safety net is vital, and the absolute best way to do that is to know exactly what is normal versus what requires medical attention. We want you completely relaxed at home. Like we covered, those scary-looking but completely normal symptoms include bruising traveling down the face, eyes smelling closed, initial heavy bleeding, and pain that is steadily improving. But you do need to watch for abnormal signs. A primary complication we watch for is a hematoma. That usually presents as a rapidly expanding, firm or tense, painful lump or a dark purple mass. Another complication is infection, which tends to show up between days 3 and 7. Signs of infection would be a fever over 100.4 degrees Fahrenheit, spreading redness, unusual warmth, or thick yellow or green drainage.
So just to summarize exactly when you should pick up the phone and call the office. Call if your bleeding doesn't stop after you've made several back-to-back attempts of applying that firm, direct pressure for 30 full minutes. Call if you experience strong itching with bright redness around the tape, since that usually means you have an allergy to the bandage. Definitely call immediately if you notice any of those signs of a hematoma or infection we just discussed. And finally, on a much lighter note, call the office to schedule your stitch or staple removal appointment if you haven't already set that up. Remember, we are always here to support you.
I really want to leave you with this final, deeply reassuring thought. The swelling, the bandages, the temporary restrictions, it is all completely normal and expected. You've seen the roadmap now. You understand the bandages, you know exactly how to manage bleeding, and you know that strict 1-month timeline for applying your Vaseline. You are incredibly well equipped with all the tools and knowledge you need for a safe, smooth, and successful healing journey. As you rest up and look ahead to your month of steady recovery, I'd love for you to think about this. Which of these simple daily routines are you going to build into your morning schedule first? Maybe it's putting your mild soap right by the sink, or keeping your Vaseline next to your toothbrush so you never miss a day of that crucial wound care. Taking ownership of these small, easy steps is going to make this recovery just breeze right by. Thank you so much for walking through this explainer with me, and we wish you a very speedy, very comfortable recovery.